Hello, this is Lisa McGehee, and I will be presenting my class plan for identification of non-melanoma versus melanoma skin cancers. This class plan is for a 2-hour class in the health assessment course and would fit into the skin, hair, and nails assessment chapter. It is relevant to first semester BSN nursing students because it is part of learning full body assessment. As mentioned in the previous slide, the intended audience for this course is first semester, usually junior year, students enrolled in the health assessment course. The learning objectives listed over the next 4 slides entail students being able to identify different types of lesions based on the information they learned in the online module for this particular class, which would be completed prior to coming to this class session. The learning domain and level for these objectives are cognitive knowledge level. This slide's objective concerns the psychomotor guided response domain. This slide's objective concerns the affective responding level domain. Contained in the pre-class module are instructions for how the students will be evaluated. Students will need to be ready to participate in active identification of lesions through the clicker response system. I will tabulate results and assign scores based on number of correct answers during the in-class identification of lesions. Also, students will be scored on their return demonstration of assessment of dermatological lesions. The assessment rubric was provided to students in the introductory course information, so they are aware of the criteria on which they will be assessed. Obstacles that I imagine would occur are that some students will not read the assigned readings in the online module. Some students may guess correctly on the lesion identification portion of class, even though they don't know the answer. And some students may not be able to pass the return demonstration. In anticipation of these obstacles, I have incorporated graded activities to ensure that students complete the readings and online module activities. Also, I will provide a demonstration of the full body dermatological assessment prior to the students performing return demonstration of same. The use of an assessment rubric for the return demonstration should also assist the students in successful completion of the evaluation. The next several slides describe the content to be taught for the 6 learning objectives presented, as well as the methods of instruction. Basically, for the cognitive learning domain objectives, I have combined online lectures and readings with in-class visual identification of lesions to appeal to the visual and oral learners in the class. The use of the clicker response system, as well as the return demonstration, will appeal to the kinesthetic learners. Hainsworth and Keyes note benefits of blended learning to be student control over content and pace of learning. Halstead and Billings note benefits of practice and feedback, as well as learning to think critically. For demonstration and return demonstration, Fitzgerald and Keyes note the technique to be effective for learning in the psychomotor domain. It actively engages students through stimulation of multiple senses, and repetition of movement and constant reinforcement increase confidence, competence, and skill retention. In regard to hybrid simulation, Fitzgerald and Keyes note advantages of psychomotor skill development, active learner involvement in real-life situations, and a safe, non-threatening environment in which to learn. To promote a learner-centered experience, I chose group discussion to address the affective learning domain objective. Other advantages noted by Fitzgerald and Keyes include increased social support for students, more positive interpersonal relationships, and that it is an effective method for teaching in affective as well as cognitive domains. Rawls states that student engagement with the information is the key for it to be transformed into knowledge. Thus, the use of blended learning demonstration and return demonstration, and group discussion should promote a student-centered learning experience. The students will use the knowledge gained in the online module to critically think about such factors as patient history, medications, environmental or occupational factors, and common sites of presentation for each lesion when conducting their subjective and objective examinations of lesions. They will also need to consider these factors when using the clicker response system to correctly identify lesions projected visually on screen in the classroom. In group discussion, students will have the opportunity to learn from one another as well as the instructor. The next 4 slides are examples of the visual presentation of lesions that the students must identify with the clicker response system. There will be 2 duplicate slides, the first showing answer choices. At this time, the students will select the answer with their clickers. After choices have been registered, the slide showing the answer in boldface type will be presented for immediate feedback. For the return demonstration of full-body dermatological assessment of lesions, students will be assessed with the rubric shown on this screen. The mannequin will be moulaged with different lesions. Students must incorporate at least half of the objective inspection palpation techniques and at least half of the subjective data questions in order to obtain a passing score. In group discussion at the end of the class period, I will use a question and answer session to identify student concerns, writing them on the board to capture common themes. Aside from student performance on outcome measures, I would measure the effectiveness of my teaching plan by using a 3 likes and a wish format on a post-class, anonymous, online survey like Qualtrics. After review of the responses, I would use the meaningful information from the surveys to make changes for the next class. The last 3 slides contain the references used in support of this presentation. Thank you for listening.